It's kind of like when they do the human factor training and you'll hear about a plane will crash and it's because someone was afraid to challenge the pilot. It's like communicate. Constantly share insights you learn. Make sure that you're sharing it equally with as many people as you possibly can. Constantly research. All the success we've had has been when we're proactively ahead of things. And what I found was we actually stopped a few other organizations from maybe going down the wrong path because they were ready to activate and they were reacting versus being proactive. You're a risk whenever you're going to jump ahead, but if you've really done your due diligence and you really have explored and you've really researched and talked to as many people as possible, it's less likely going to bite you later.
From the basement to the boardroom, from ideas to innovation, you're listening to the Beyond Clean podcast, the central nexus for the people, processes, and products that are pushing the sterile processing industry forward. Each week, you'll encounter diverse perspectives from subject matter experts across the country and around the globe. Frontline technicians, CEOs, engineers, and entrepreneurs with a common goal to help you fight dirty. Every instrument, every time. Whether you are tuning in for education or inspiration, we're glad you're here. Now, turn on those washers and turn up the volume. It's time to go Beyond Clean.
This week on Beyond Clean, we speak with Jason Unger, Director of Surgical Services and Anesthesia Institute at Cleveland Clinic Abu Dhabi. Jason is a Canadian with a background in medical device reprocessing and has worked in Canada, Saudi Arabia, Ireland, Bahrain, and now Abu Dhabi. His career started as an Isham CRCST, then Bachelor of Science in Sterile Services, and most recently a Global Executive MBA with IE Business School. He specializes in new startup designs, commissioning and unit renovations, and also has a strong focus on professional development as a certified crucial conversations trainer, serving leader, facilitator, and coach in brain-based Gallup and Press Ganey. As the Director of Surgical Services and Anesthesia Institute, Jason is responsible for the strategic planning and scheduling of all OR and procedural rooms and has been the chair of the United Arab Emirates Decontamination and Sterilization Conference since 2014. So, Hank, we'll talk about this with Jason as we're starting our interview with him. But Beyond Clean is the global voice of sterile processing, and every season we try to make sure that we're bringing in perspectives from other countries than where you and I live in the United States. And I know our listeners like knowing what's going on. So I don't think we've ever interviewed anybody from the United Arab Emirates, and I think this one is going to be very interesting to compare and contrast, especially related to the pandemic, because I know that's going to be a point of conversation today.
That's right, Justin. I'm looking forward any time that we get another voice, as you said, from the sterile processing insight, but in different geographies. It always brings me back to what Renee Vies said on our podcast about these microbes not respecting geographical borders, definitely not national borders. Well, the same thing for our podcast. We want to pull in insight from around the globe, not just to have a conversation, but to have a conversation that changes how we respond as a global industry to global challenges that confront us. So I'm super excited to talk to Jason about those themes today.
All right, well, we'll be right back with Jason Unger after a short break.
You're listening to Beyond Clean, the global voice of sterile processing.
Joining us now is Jason Unger, Director of Surgical Services and Anesthesia Institute at Cleveland Clinic Abu Dhabi. And Jason, we're really excited to have you on the show today and talk about your work in CSSD. So thank you for joining us.
Thank you very much. I'm really excited to participate.
You will be our first global voice of sterile processing this season, and we do really like to get perspectives from other countries on here. We have a lot of listeners outside of the United States, and so having guests like yourself is just so critical for the show and for our audience. So why don't we just start with how you got interested in sterile processing?
Okay, so that's kind of a fun one in the sense that this is kind of my accidental profession. And what I mean by that is from high school, I actually lucked into a job in my hospital, my local hospital, where they actually separated sterile processing into sort of 3 different sections. And they had one section that was just decontam alone. And as you would imagine, many people don't like to be in decontam. So I was able to get a job while I was in high school, working the decontamination. And it was actually meant to be my job until I got a real job, so to speak. because at that time I only saw it as a short-term solution, especially back when I started, because this has been 30 years now, actually over 30 years. And at that time, the only thing I knew of was kind of technician certification training and not really more of a career ladder. People tended to go from there into things like nursing or other areas of healthcare.
And, you've obviously grown into a leader and, you got 3 decades of experience there. Can you tell us a little bit more about, how you evolved from just entering the industry into a leadership position and maybe some of the things that are important to you as you lead?
I guess where it really started from was when I first was in the profession, when I first worked as a technician, I had a very inquisitive scientific mind. And at that time, I would push and challenge about a lot of the processes we were doing. I would feel like, is that really safe what we're doing? And I'm thinking particularly around the time of ETO. ETO is not used in many countries now that I've been working in, but at that time it was very prevalent everywhere. And what was sort of the mindset at that time was, if it can't go in steam, we'll just throw it in gas. And so for me, that was like, I knew that we used back then the Sidex containers, and they said that they could be sterilized in ethylene oxide. And then at the time, for cost cutting, the hospital was trying to use things like Rubbermaid containers instead in place of. And that's where the real sort of leadership or the idea of this as a more important profession came of, hey, is that safe to be doing that? Is that something that actually would be compliant and meet the needs? And so I think that was kind of the initial instincts of it. And what really kind of switched the level to it, where I started to see it more as a career, is when I had the opportunity early. I was only working for maybe 7-8 years, and I had the opportunity to move to the Middle East to work in sterilization, which I never would have thought would be kind of the type of profession that would allow you to move globally.
Yeah, Jason, as Justin said, the audience for the podcast in particular in the Middle East is pretty large. And as we kicked off the show, 3 years ago, if you were to show me a world map and asked me, to pick the places where I thought the podcast, these kind of conversations about the industry themes that you just mentioned, where would they be best received or most received? I don't know if I would have picked the Middle East to be one of the primary audiences and engagement in the show, but over the past 3 years, it has just continued to grow, and we get so much great feedback. And yet I think a lot of the rest of our audience, may not understand what the network looks like, what the industry looks like in the Middle East for CSSD, the training and requirements, if and how they differ from other parts of the world. Could you speak to a little bit of that just from your own perspective?
Yeah, I think, as you said, there would be a bit of a blind spot, especially if you're coming from North America, because I'm Canadian, in the sense that we would always assume that, we're ahead of this. We have all these different associations, and we have all these memberships and all these union environments, and we're always thinking that we're the best at it. But if you actually come to the Middle East, they probably set a higher bar for this field than pretty much any other region of the world. For example, here in UAE, United Arab Emirates, I can't even consider employing someone unless they have at least a minimum of 2 years CSSD experience. So it can't even be health related. They have to have it actually as a technician or higher in CSSD. And they have to have either an associate degree in sterile processing, which would be at least 2 years in length, or they have to have some type of certificate in health related field and have also completed like an ISHM or a CBSPD type association with membership. So if they don't meet that criteria, I can't even employ them in the first place. So that whole path of even hiring people fresh from high school, like the way I started, never would have been available to me if I was living here in this country.
Well, so thinking from the perspective of a manager, and I know we've got a lot of folks in the States who are confronted with the challenges anytime that you have that kind of requirement for prior experience, the question always is, well, how do they get that experience? So what does that look like then in country to source candidates that only have prior CSSD experience?
The real crux is you can't sort of develop from the local community. But then the Middle East in general tends to rely on a lot of expat workforces who are only here to work. So you have people who are going to school, but it's because their parents are working here. But once they turn of age, they usually return to their home country to go to do further education like university. So we don't have that same pool of resource that you'd have in other countries where maybe from a high school, you'll find people who have the right competence and you can train them on the job and build them up slowly over time. So the biggest challenge, honestly, for us is that we have to recruit from external. It's very challenging to hire anyone from Canada, the US, and most of Europe because generally they'll have the ISHM certification, but the expectation is they must have also some type of health-related certificate as well, or an associate's degree, which most won't have in those regions. So that makes it another challenge in that it actually diminishes my ability to have more diversity. Unless I get someone, where it tends to happen is a lot of my staff will have a practical nursing degree, but then didn't feel it was fulfilling or it wasn't quite for them. And now because of it, they took ISHM and had some experience at a previous place, and I was able to bring them in. So a lot of my team have a stronger sort of background, but it's usually because they've got a nursing or some other health-related field background to it.
That's interesting. So through that associate's degree requirement, then what is the thought process behind requiring that in addition to these credentials from ISHM and CBSPD, right? So in the U.S., obviously, the standard in at least 4 states now requires certification, but across the country, it's kind of up to each facility to make their own standards, and I'm not aware of anybody that requires any type of prior degree in addition to certification. So what's driving that decision behind those standards?
So this is where I'd have to use the benefit of being in the Middle East for a while, that this would not be necessarily the absolute reason for it, but I would suppose that it's more to do with they tend to recruit from a lot of local areas. So we'll get a lot of recruits from India, a lot of recruits from Philippines. And in those places, what they tend to have is they won't have the ISHM or CBSPD. They won't have as much formal on-the-job training, but they have these training sort of colleges. And what they do is in those places, it's more like a work experience training. So they'll work at a big university hospital. It'll be a 2-year diploma. And so I think what happens is they tended to look at that. And they tended to look at ISHM and they assumed, well, if India has a 2-year degree, then everyone has it. So I think it was probably an oversight that they just looked at, well, everyone should have at least that minimum 2-year that we see from India and Philippines. And if they easily, Europe and North America would have that as well, without recognizing that actually Europe and North America have the benefit of a more structured environment that they can bring people in from the ground level without the experience. And actually, my understanding, so you could correct me on this one, I think in the US now with the 4 states that require it, it's even that I think you have like a window of a year to complete it, isn't it? That you get on the job training, but you can't continue if you don't get certification.
Right, yeah, and it varies from state to state, yeah, anywhere from 12 months, 18, 24 months. So it's still, even in states that require it, there's still a diversity of perspective on that. And of course, the questions that we ask often on the podcast and in our networks is, are the requirements that we have today, are they trending toward higher quality in the output of these departments and job opportunity and growth for the technicians, and in particular impact to compensation levels with those requirements, or are they not? And I think the data at this point is still out there for review and research. We're doing a lot of that obviously through Beyond Clean and our research division. But I'm curious too, hearing this, the challenges around recruiting. Can you speak to, outside of just human resources, are there any other CSSD specific challenges that you're confronting right now in UAE?
Probably the thing that's impacting most of the world right now, which would be the COVID sort of shutdown of global traffic. So there's a lot of countries right now that normally we would be able to recruit from. But at the same time, so we had COVID hit us earlier than a lot of other countries. And so we kind of went through the period of 2-3 months of really slowed activity. So that gave us a breather with the existing staff. And we weren't in a situation we had lost people. But for any of the facilities that might have been a bit short, they're really struggling right now to bring additional resources in, because you just can't fly right now, or you might not be able to get a visa, So I think, to be frank, that's probably the biggest challenge. Is it's always coming down to meet the professional qualification requirements that this country expects. Because if you get people, once you get someone who's got at least 2 years experience in a CSSD and they have some kind of medical background and it's some kind of diploma course, even if it wasn't the best one, it's still going to give a lot of the practical tools that when they come here, you've already got a really fantastic foundation to start from.
It's interesting you bring up the pandemic and some of the challenges already, but I'm interested, just from a leadership perspective, as a surgical services director, I got to think there's a lot of decisions you have to help people make, your leadership, decisions you have to help make for your team. And then also you're in somewhat uncharted territory. So there has to be a certain level of uncertainty, and yet somebody has to lead. So what is your perspective, having gone through that over the last, 5 or so months at the time of this interview, from a director, from a leadership position? What's your perception of the pandemic, and how did it impact you and the people that you are managing?
So I guess this is why I have to really give credit to being where I live right now, which is in Abu Dhabi, in the sense of they very early took the pandemic seriously. And what I mean by that is because they immediately took action of let's close down, let's quarantine people, let's close schools, let's shift holidays. They really did some dramatic changes quickly. And I think because of that, because it was so across the board, it really helped realign everyone in the sense that then everyone immediately went, okay, well, we have to really stop and think about this. We have to really understand, how do we have to adapt to this? And I think that really set the tone. It's kind of like Cotter's way of change. You have to have your impetus to make things change. And I think that was really the catalyst that allowed just people to stop, because everything slowed down. It was like, okay, so now let's plan for scenarios, what we think can happen. Let's think of the absolute worst, and let's think of all the different variables in between. And it really gave us some time to strategize. And, when you've got the government doing it at that level, and then here in the institution, right away, we could immediately think, okay, well, we're going to have to, reduce our elective procedures. Now, we do a lot of urgent emergent, so that's actually a significant portion of our work. So we still had to provide service, but probably around 60% of our work was stopped immediately. And so because of that, immediately you need to redeploy and rethink about things like, how do we change access into the hospital? How do we make sure that people are safe? How do we, look at workflows, how people move even throughout the organization? How do we herd traffic? Who needs to be here in the hospital? Who should actually be working from home? But in a way that, you weren't running at 100%, you're running at 50% or 40%. So it allowed you to do it without really destroying quality and being able to keep up with some basic service levels. And so I think that was really the success, or that's what really helped. And I think when I look at a lot of other countries, where you'll see different countries, different states, where one country will do something really strongly, but another one kind of does a half measure. That's where I think we were lucky in the sense that they were very uniform. They just said, look, we're going to do this. We're going to suffer a little bit, but it's better to do this. Then as we opened as well, and as we reactivated things, it's been very much, okay, we're going to reactivate this to a limited degree for the next 2 weeks. And then in another 2 weeks, we'll do a little bit more. And I think that also helped people, that they didn't kind of think of it's either all or nothing. It's like, how do we slowly adapt back into normal work, our sort of workflow's existence, but in a way that we don't jeopardize having to go back to that harsh action again.
And Jason, the way that you popped up on our radar actually was through LinkedIn, and it was a post that's related to the pandemic response, obviously. And I wonder if you can talk a little bit about what the awards were that you and your team received in your response, and what they had to do, again, from the sterile processing perspective, because you gave great insight right there from how the government responded, how facility leadership responded, but your team in particular responded in a particular way, and it looks like y'all got a great recognition for that. So I'm wondering if you could take a couple of moments and just explain what all went down there.
I'll start with kind of my role now is a little bit broader in the sense, so it used to be only medical device reprocessing, but now it's around managing all the ORs and the procedural areas. And so one of the first things we recognize is, well, if we get hit with a lot of sick patients, we're going to need a lot of intensive care unit beds. And we benefit from having 72 already in our hospital. But we immediately thought, wow, if we really get slammed like some of the countries are getting hit, like when we were looking at Italy and Spain at that time, we thought we're going to have to think about where can we give this extra capacity. So once we knew we were going to reduce our elective cases, we immediately looked at our PACU beds in the OR, the post-acute care area, and we immediately started planning for the potential to go up to 36 of those beds to convert from PACU beds into ICU beds. So that helped kind of set the stage that we were already thinking, we were messaging to teams, we were assessing everyone's skill set, who could be redeployed, what do we have to do to move equipment in order to convert these beds in a way that we can use them as ICUs. And then immediately the minute you start thinking about that, then you have to think about the personal protection equipment. Now, we're very well resourced. We have incredibly good resources and we have really excellent supply chains. But here's the thing, all of a sudden N95 masks, before we had plenty in theory because we don't really use them that often. But all of a sudden, when everyone needs to have them everywhere, and if you use them the way they're meant to be, which is you use them while you interact with the patient, you walk away and you discard it, you're going to burn through what used to last for 3 months, probably in less than 3 days. So it allowed us, because before we even got inundated with all these numbers and we were in preparation, then we started to research, well, how can we extend the life? So the PACU was the first of into ICU. Then it was like, okay, well, if they do come, how do we protect? So what happened was I really just reached out to lots of colleagues and contacts throughout the world. I did a lot of research. Luckily, organizations like ECRI were very quick to start publishing updated information about how we could respond to this pandemic. They were actually ahead of the CDC really on this one. And also there's another group, the N95 Decon group, which was sort of just a bunch of universities and hospitals that took on more direction as well. But by the time we were actually in a position where we thought, well, we'll have to do this, we actually had a lot of good evidence to support 3 different ways that we could start looking at disinfecting N95 masks. And that was the biggest critical, because gowns and cover gowns, things like that were a lot easier. We have a lot of them, and it was also easier to look at reusable. But the N95 mask was a significant risk for us. And especially with supply chains being diminished. Great, we have a lot right now, but when everyone in the world is looking for it, well, all of a sudden your supply is dried up. So we had to really think responsibly, how can we conserve ours? And also we had to be thinking, because we're a big hospital within a small country, but we don't want to diminish what the requirements for the rest of the country are as well. So the better we can steward our resources, that gives more capacity for the rest of the country as well.
This whole topic and this theme of leadership, you just tied that into how you were leading as an organization, because conservation of resources, and look, part of what happens in a pandemic is people panic. There's a lot of uncertainty. They don't know what's coming around the next corner. And, you know, as you mentioned, being ahead of the game, and you referenced ECRI, which is actually based where Hank and I live here in Pennsylvania. You mentioned that they were trying to be very proactive about it. There's risk in being proactive because you don't necessarily have all the information. But one thing that you can say pretty clearly, that conservation of resources was illuminated very fast for everybody in the industry. And how are we going to do this? And there was already a disruption in supply chain that just was horribly timed just a few months before the pandemic hit. So supply chains were already impacted. Then that happened. And then, of course, where that is manufactured was also impacted by the pandemic because it's global. It's not just regional. So we all have to chip in that way. And I just want to commend you for doing that as an organization, not just, you know, as you lead your departments and your teams. So this has been a really good interview. And I just have one more question, because I was listening to you and you were sharing a lot of really good insights and lessons learned. But I would like you to take that just a little bit further for other leaders in the operating room, in sterile processing or CSSD, and really from a leadership perspective. What would you share with them? What would you tell them was really critical as you were managing the pandemic?
The one thing that really came to mind, and I'm a bit of a broken record with my team around this, and that is, it's kind of like when they do the human factor training, and you'll hear about a plane will crash, and it's because someone was afraid to challenge the pilot. It's like communicate. Constantly share insights you learn. Make sure that you're sharing it equally with as many people as you possibly can. Constantly research. All the success we've had has been when we're proactively ahead of things. And what I found was we actually stopped a few other organizations from maybe going down the wrong path because they were ready to activate and they were reacting versus being proactive. And to your point, like, you're a risk whenever you're going to jump ahead, but if you've really done your due diligence and you really have explored and you've really researched and talked to as many people as possible, it's less likely going to bite you later. For example, we did the UVC disinfection, but we had actually done a lot of research on the effectiveness of UVC. We looked at a lot of examples of other organizations that had already implemented and published research on it and looked at how could we replicate that. And then by the time we were ready to test it, well, we already started to get evidence from ECRI. And then by the time we had tested it and we're thinking, should we pull the trigger, the Group N95 had actually published as well. So by that point, we felt really comfortable that we really did the due diligence and we were doing the safest thing possible. So we're actually a COVID-free hospital. Everyone who comes in for procedures, we swab them. So we don't actually have any COVID here. And so basically because of that, our N95 mask demand is gone again, or it's back down to sort of more normal levels. The thing is, we did this pandemic response because of COVID. And what I was very fortunate is we also communicated very effectively that the minute we start to diminish that number, or we don't need to protect our caregivers for that, we also have to stop doing this, because that is not the intended use of why we were doing it. We were doing a pandemic response. Communicate, research, talk to as many people as possible to challenge your ideas and make sure that you're really making the best decision you can with the best information, but also recognizing where you have to rein yourself back so that you don't use that as the crutch, because I think this might be a situation where people get into bad habits and start to reprocess a lot of single use where they shouldn't be. If legitimately you need to be doing it to keep people safe, yes, do it. But if not, then go back to what you know is the correct way to do your processes.
Jason, this was a fantastic interview. I like the perspective from leadership, but also that we really focused a lot on proactive versus reactive, and especially in a pretty high stress environment. And so thank you so much for coming on. Congratulations to you and your team and for all the great work that you were doing as an organization to lead your region and your country.
Thank you so much. I really enjoyed it.
That was Jason Unger, Director of Surgical Services and Anesthesia Institute at Cleveland Clinic Abu Dhabi. And Hank, we've really kicked off this season with a lot of leadership style conversations. And I know we did a number of bonus podcasts and episodes when we were early into the pandemic. But I think what was kind of neat in talking with Jason is getting perspective now a little bit further down the road. because I remember kind of the state of mind that we were all in April and March versus how we are today. And while it's still a big challenge and many hospitals and healthcare providers, and even my wife is a teacher, there's still a lot of concern in the community. But I remember, and it still happens now, PPE, PPE, PPE. And so I just think the stories that Jason had to tell us about, leading through that and leading not only, his department and his team members, but also how his organization and his country led the way too, and how blessed he felt for that. And that conservation of resources, it can never be stressed enough, because that is going to be an ongoing challenge here in the United States for sure.
I found it interesting, Justin, how similar those challenges were. We talk about it as a global pandemic, and we speak on the podcast oftentimes as a global industry with similar challenges. But it's a good reminder and confirmation, I think, for me, but also probably for the audience, just to hear that the challenges in a small hospital in Montana can be similar as one in the Middle East in terms of conserving that PPE, as you said, protecting patients, protecting your staff, being innovative for how you're going to approach your response to a global pandemic. And I hope that the audience is encouraged by this and renewed in the power and the value of networks, because something that you heard Jason say is the first thing he did is start reaching out to his peers, not only in country, but across the globe. And so it's so vitally important to be building those relationships at all times, but especially when you need to reach out and share insights in these issues of emergency response.
All right, that's going to do it for this week's episode. As a reminder, you can help support Beyond Clean by subscribing on iTunes, Stitcher, Google Play, and Spotify, or by downloading our smartphone application for iPhone and Android. We'd certainly appreciate a rating and a review, because your feedback is important to the show. And if you have any topics that you'd like us to cover on a future episode, just send an email to info@beyondclean.net. On behalf of Hank and myself, thank you for listening to this week's episode of Beyond Clean.